crazy. Alright, I have your chart here, let's see. So we're here to discuss your Alzheimer's disease, and as you know, it's a terminal illness, so we have a little bit to discuss about some future planning and treatment stuff. I have your newest test results. Yeah, just want to make sure that everything's going as planned for us.
What do you mean she has Alzheimer's disease? This is our first appointment.
Yeah.
Are you Barbara?
Yeah.
Okay. Well, this is not Barbara's chart. Give me just a second. Let me see if I can find it. All right, okay. Wow, not my day. I'm so sorry. So, we have your test results back and you have Alzheimer's disease. So, as you may have heard, this is a terminal illness and we need to start discussing some plans for the future. Where do you live right now?
I live in Pittsburgh.
Okay, do you live in an apartment building or in your own home?
I live in alone by myself in my own
Okay.
home, yeah.
Well, that's probably not going to be a permanent situation for you. What do you do for a living?
I'm an occupational therapist.
Okay, so you can help her, you know, in the future we can maybe figure something out for that, right?
Yes, we can.
Okay. Sorry, this is like so future thinking, but do you guys have any questions? What do you guys want to learn out of this session today?
Well, I imagine her concern is, like, my sister is super independent, and so this is going to be a really big change to having to have me and, like, her other family help her do things as her Alzheimer's progresses.
Are you sure this is Alzheimer's?
Well, that's actually a really good question. So it's kind of hard to diagnose Alzheimer's now, but because of the symptoms you had of being forgetful, we ran a couple of cognitive tests on you and you failed the tests, which means that you most likely have Alzheimer's.
Wow.
Could it be something else? You said it was hard to diagnose.
Yeah, so it might also be dementia, but because you are somewhat young, we would most likely go with early onset Alzheimer's. What really matters are your symptoms, whether or not you have like the title of the diagnosis or not. Do you have any concerns about going home today or about like the next couple of days? Also, we should talk about medications at some point, but
Well, we're just kind of overwhelmed.
Yeah, this is a lot of information at once. We don't really have time to process it.
yeah, well, unfortunately, I have not a lot of time to talk to you guys, so I want to make sure we get everything covered that I need to like make sure I talk to you about, and we can maybe schedule an appointment later on to go over some more of the details. So for right now, you seem to be functioning okay in your home. I would suggest you visiting more often. You can probably live alone for a while now, but you need to start making plans for the future. And noticing her symptoms. It would be great if you could just try to notice frequency of symptoms and if they get more severe. As far as medications go, there are medications that could help slow the progression of Alzheimer's disease. Their effectiveness is not entirely documented, but it never really hurts to try to help slow things down. So I can talk to a pharmacist about getting a prescription for some of that stuff.
How much would that cost, though, if we don't have much money?
Yeah, so insurance should cover some of it, but I think some of it will have to be out of pocket. Again, this is something we can discuss at a later date if we need to. I know I'm throwing a lot on you guys right now.
So how long do you think I have before I'm not able to be independent?
That's really variable. I can't give you a good number. You're pretty young still, so I would guess have a couple good years left, and then we'll progress you. You know, maybe we'll have an aide come in to help, and then as your disease progresses, you'll need more and more help, and probably will eventually end up in a nursing home.
Wow.
Is there some sort of support group we can reach out to until we see you again?
Yeah, I'm sure there is. Before you leave, I'll get some information on that, but I don't have that with me right now. Sorry. I'll catch you out in the waiting room before you head out.
Okay.
Wow.
Well, I have to run to my next patient. I have some literature for you guys to read over before you leave, and I'll have my nurse check you guys out in just a couple minutes, but I want to give you some time alone to try to talk through stuff in process, okay?
Okay.
All right, here's some flyers. This should explain a little bit more about some of the questions that you guys have, okay? All right.
Thank you.
Yep.
Oh, this is a lot of reading. How does she expect us to know all this?
I don't know. It's a lot of terminology. I don't
Yeah, it's only been
understand.
5 minutes. How are we supposed to process the fact that you have a terminal illness in 5 minutes? What an awful doctor.
A lot just went through my mind during that meeting that just happened. I went in and this was the first time I was meeting the doctor. She kind of just threw all this information at me, didn't really take the time to ask how I was doing or how I was feeling. Immediately after she told me my diagnosis, she immediately started discussing treatment options and plans without really asking me for my opinion or what I thought was best for myself. She threw a lot of information at once that was hard for me and my loved one to process, and she seemed really rushed about the whole thing. She got my file mixed up with another patient, which I thought was really horrible because it seemed like she was running through her files rather treating each of her patients as a person. Her tone of voice was very rushed. Didn't really help in settling in with the information. And it was just overall not a good process or situation when I'm wanting to learn that I have a terminal illness. I would have appreciated something a little more genuine and not rushed and caring and more empathetic.
That was just such an awful appointment. She was so rushed and didn't really help us sort through our feelings. We got a book thrown at us, 51 pages of info on Alzheimer's that none of us really understand. Like, I'm an occupational therapist, but I work with 5-year-olds. I've never worked with older people, and I don't know how to care for someone with Alzheimer's. And here the doctor's telling me that I have to become the primary, caregiver of my sister who has Alzheimer's now. I work 7 to 5. I can't do this every day. I have no idea what to do, and the doctor just didn't really, just overwhelmed us, didn't really give us any options or took the time to make sure we're okay.
Wow, that was a really terrible appointment, and I realize that now. I mixed up their paperwork. I can't believe I didn't check her name before I came in here. I didn't even ask what her name was. I've never done that before, and that was terrible. I mean, I don't know. This day has just been so crazy, and I'm so stressed out in this office. I'm new to this job, and I don't really like working with patients with dementia and Alzheimer's. It's just so hard and depressing to watch them realize that their life is going to continue to change and deteriorate, and they're not going to be able to remember anything anymore. It's really emotionally draining to take people through this realization so many times a day. But I don't know, that was just a really bad appointment, and I just threw some paperwork at them because if I don't get to my next patient on time, my supervisor is not going to be happy. I just feel really pressured time-wise around here to see patients really quickly, and paperwork and pamphlets are the best thing I've found so far. Maybe there's a better solution out there. I don't know. Hi there, my name's
Hi.
Dr. Miller. Just to check real quick. Are you Nana?
Yeah, I'm Nana.
Okay. And I just want to check some of your information before I get started today. Make sure I have everything right in my paperwork. Are you 57 years old?
Yes.
Yes, okay. And I have a little information on your living situation. You live on your own in Shadyside, is that true?
That's
Okay,
correct.
very cool. I have a lot of good friends out there.
That's nice.
And who did you bring with you today?
This is my sister. She's my
Hi,
best
I'm
friend.
Jen. Very nice to meet you.
I'm glad you brought somebody with you to your appointment. So this is the first time we've met. You went to your primary care physician a couple weeks ago with some forgetfulness symptoms that you were concerned about. He did some testing with you, and then you've been referred to our office.
That's correct.
I have the results of your testing with me and some serious topics to talk about today. But before we start, I just want to reassure you that me and my team are really good at what we do, and we're here to help you with whatever you need, whether it's related to what we talk about today or not. You're always free to call us, okay? So the results of your testing shows that you most likely have early onset Alzheimer's disease. And I know that's a lot to hear, so just take a minute, okay? Now, you seem pretty shocked, maybe a little confused and upset, yeah? And I absolutely understand that it's hard to take in information like this. But I'm really impressed that you went to your PCP with this information. I mean, a lot of people wait a long time and brush off these symptoms, and then we have to work really fast. But now we get to take this step by step, and we'll work through it together, okay? So tell me a little bit more about what you're concerned about, and then we'll talk more about questions. Anything that you guys need to know, we'll talk about today. I don't want to get into treatment or medication or anything crazy like that because you have so much time before we need to be there, okay? And we've already got you on our schedule for a follow-up appointment later. So today is just about working through your diagnosis, okay?
Mm-hmm.
So what else do you guys want to talk about today?
This is all just really such a shock, and I'm such an independent person, and I just want to be able to keep that independence as I get older. I'm scared as to what's going to happen in the future, especially because I live alone.
Yeah, absolutely, and that's a pretty common concern with people with your diagnosis. I can let you know for sure that you are so independent and so early on in this disease that you have a lot of life left to live and a lot of time to remain independent. We'll help you with maybe a couple tools to preserve your independence. We might have an occupational therapist come into your home and set some things up just to make life easier for you. And later on down the road, when things start to change, we will work with you to set things up and make things as independent as possible for you, as long as possible. Do you have any concerns that you want to talk about?
I do. So, like you said, there might be some time before we have to worry about this, but I was kind of concerned about caregiving because at some point my sister will need help with doing things around the house and everyday things. I'm an occupational therapist. I work like 7 to 5, so with a full-time job, I really can't always be there for my sister when she needs me. So, do you have any recommendations or alternatives?
Yeah, absolutely. And you are the most adorable sisters I've ever met. Yeah, they're so cute. So right now, like we said, it's not necessary for you guys to, you don't have to support her, caregive, or anything like that. But eventually, you might need to play some sort of a role, and that can be determined down the road. Even just dinners together on occasion might help keep things normal. But we also have a number of nurse aid groups that we work with where the nurses will come in and help. Maybe once a day, maybe twice a day. They can stay longer if they need to, that kind of thing. We have a lot of resources for you. I can talk through some more of the resources, or if you just want to take some information home about the resources and look into what you might prefer in the future, planning together is always a good idea. But right now, you don't have to do that, and we can definitely talk about that more in the future. Is there anything else that we can talk about?
We're still trying to just absorb the news,
Right.
but thank you for your help.
Absolutely. Yep. And just before you leave, talk to our receptionist and she'll confirm your appointment for next time. And that's when we'll talk a little bit more about medication and all that kind of stuff. But I want you guys to take time as family just to work through everything together, okay?
Great.
All right. It was
Thank you
really
so
nice
much.
to meet you
It was
today.
nice meeting you too. Thank
Okay.
you.
I'll see you in a couple weeks.
You too. Bye. That was really shocking news, but I thought the doctor came to us and approached us in a good manner, and it kind of helped me absorb the information better.
Yeah, it's nice how Dr. Miller just reserved this appointment to focus on our feelings rather than just throwing treatment options and like diagnosis information at us. It was really nice.
I think she actually understood how I felt and helped me sort of work through those emotions. And it didn't seem rushed at all. She took her time with us. And I liked how she reassured us that she was going to be there every step of the way. And it felt very individualized to me.
Yeah, and she put a priority on, or she listened to your concerns about losing your independence later on, and she addressed those first. Yeah.
And I like how she gave us time to kind of talk about this as a family before we kind of decide on what route of action we want to take in the future.
Yeah, it's still scary, but after talking to Dr. Miller, it's not as bad as it could be.
Definitely.
So I think that appointment went better. I decided after reading this book to try to focus more on my patient's emotions the first time I break the news of a diagnosis to them, especially because it's already our clinic's policy to schedule a follow-up meeting a couple weeks later. It seems appropriate to give the family time to digest this new diagnosis and consider all their questions about treatment before I start throwing information at them. I actually timed this one and it was faster than the last diagnosis appointment I did, so I feel like it's a good use of my time and I get to pay attention to my patient's needs, and I actually feel more not fulfilled as a doctor, but I feel like I'm taking better care of the people that I'm serving and not just making my supervisor happy. But he is happy because I'm getting things done quickly and our patients are happy. He doesn't get as many complaints. So I feel like I figured out how to work in this clinic and in this system.